Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomason, Swanson, and Zahn Attorneys at Law.
Hi, I'm Dr. Gothenburg, practicing chiropractor in Pelican Rapids. And I'm going to revisit a subject that we probably addressed 2 or 3 years ago, and this is pain in the lower back, what often we as chiropractors or doctors may refer to as the sacroiliac joint. So the sacroiliac joint is formed in part by the sacrum, this triangular shaped bone, and the ilia or ilium. And as you can see in our example here, this is a very long, broad joint where simply two bones oppose each other. It's a joint that's very dependent upon strong, taut ligaments. If that ligamentous support isn't there, then the muscles have to react by tightening or becoming taut, causing pain. And this person, more likely than not, would maybe feel comfortable sitting, but when they first stand from a seated position, has pain. The same person might have a problem being able to sleep on the right side. The confusing part about this is it has different origins. So as far as assessing someone, we want to look at the hip on the same side, the joint itself, and we may even look somewhat higher. As I discussed just earlier, as far as points of identification, this is the top of what many people call their hips, or the top of the crest. Directly below, which would be at belt level, is the sacroiliac joint. It's a long, broad-based joint. As far as areas of pain, one could have a problem that generates pain directly from the SI. That pain also could be generated from the hip on the same side, or in fact at an area just slightly or 4 to 5 inches above the lower back in this general area. This general area usually reflects pain to the top of the crest and the hip on the same side. There's a very simple test that we use that helps identify whether or not the problem is the sacroiliac joint. And what I do is I placed my thumb on the sacrum and my right thumb on the ilium, and now I'm going to have Brenda just lift her right leg. And when Brenda lifts her right leg, there are certain movements that are unique to this joint, and what we simply do is compare the movement of one side to that of the other. That often gives us really helpful information as to how we want to treat or manipulate or adjust the joint. One of the factors that we look for as far as what could be contributing to either hip or low back pain is we look at the instep or the arch. And here's a good example where the instep on the right is flat. It's a flat arch. So when we see a dropped instep, its effect on the leg would be to cause the tibia to rotate, the femur to rotate, which causes the pelvis on the same side to flex. This is going to cause friction or pain in the hip area or in the right SI joint. So again, foot posture is extremely important when assessing chronic pain in the lower back or hip on the same side. As far as treatment, we approach it from multiple angles. Certainly, we consider the foundation of the feet important and how it causes distortion going up toward the hip and pelvis. For the joint itself, we certainly use techniques that are designed to tighten or stabilize the ligaments that support the SI joint. So at this point, if you have questions as to where your pain originates, what's causing the pain, We're here in Pelican Rapids. We can help you by doing a real thorough examination and try to get you feeling better.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, MAHUBE-OTWA Community Action Partnership, Lakeside Sports and Pain Clinic, and Thomas & Swanson & Zahn Attorneys at Law.